Hi guys, my name is Alexis and welcome back to my channel. In today's video, I'm going to be talking about Camila coming home from the NICU and our first few weeks being home right before Camila had her first surgery. So Camila came home a few days after being born. She was in the NICU for 4 days and she was born on April 24th. On April 28th, she came home that evening and we were so excited to have her home. I beat myself up about it because we didn't take any pictures of her coming home from the NICU. We had a really cute coming home outfit for her and she looked so cute in her car seat, and we didn't even take any pictures. We were just so over the moon with having her come home that we totally forgot to take pictures. But I think we were so in the moment that we didn't even think to take pictures. It was just very special though, and I still remember it. I wish I did have those pictures to share, but that's okay. So that evening, me and Ben had our parents come over. So because of COVID, we didn't have them all come over at once. We had Ben's parents come over first. Ben's parents have been social distancing. They weren't seeing anybody. Ben's dad was working from home, so they weren't seeing anybody. So we felt like it was okay for Camila to meet his parents. His parents did, wear masks and were very clean and sanitized and made sure that they had showered right before. We did take all the precautions that we felt like we needed to with both of our parents. So Ben's parents came over first and got to meet our Camila, and they were so excited. We were over for maybe like an hour and a half, just holding her and getting to spend time with her and meet her, and that was really special. After they left, my parents came over and were over for a few hours. And that was very special for me just because I was just so excited for my parents to meet Camila, and my little sister came over to meet her too. My brother wasn't able to come. He was not in Colorado at the time. He was working in Texas, so I was bummed out that he wasn't here. But we were FaceTiming him and he would eventually get to meet Camila. My little sister and my parents were able to meet Camila and spend time with her. And my parents and Ben's parents both had brought us just some food and some meals to have. They knew it was gonna be a busy first few days for us for sure, just getting adjusted to having Camila here. It was a little overwhelming at first, just having Camila here and having all these people around us, and then out of nowhere, it's just, after everyone left, it's just me, Ben, and Camila. It was a weird transition going from, we have, guests and visitors, and then it's just us. And it's kind of scary because if I had any questions, I would just, I would ask my mom. It felt really crazy. So that first night, it was very scary. So that first night, we're getting ready for bed and Camila is crying and crying and crying and really would not stop. We did have the bassinet set up by our bed. She was sleeping on my side, but she was not sleeping. She was really just crying all night. At about 11 p.m., 12 p.m., she started breathing really quickly. She started panting, like she couldn't fill her lungs with air. It felt like she was panting and just couldn't get enough air in at once, and that was very scary because she sounded like a dog panting, and I didn't know what to do. I mean, it freaked me out. Me and Ben, she was crying. If she wasn't crying, she was panting, and this went on for hours. I didn't know what to do. I was told to expect this. I was told Camila's breathing might be a little fast, but expect this in the next few days. This is what I was told from the neonatologist before we left the NICU. I was told to expect that in the next few days, not that night. And I guess I just didn't know how aggressive the rapid breathing would be. It was just more than what I thought. I didn't know, do I go to the emergency room? I don't want to be the mom that her daughter was in the NICU and that same night she goes to the emergency room. I didn't want to be that mom that's like, oh, there she goes. She doesn't know what she's doing. But I didn't know, was I over exaggerating or was this normal? Was this normal for Camila? I don't know. So really, all night long, me and Ben just stared at her and hoped for the best. I mean, I did know to look out for signs of low oxygen. So I did know to look for blue lips, blue fingertips. I did know to look for if you could see her ribs too much. They did show me what normal is for her and what abnormal is for her. It was, at times it felt like it was maybe borderline of, should I go to the emergency room? Do I go back to the hospital? And this isn't right. I didn't know. I had never spent the night with her. I wasn't sleeping in the NICU, so I didn't know, well, was this how she was every night? I don't know. I was told she was sleeping so well, and she comes here and she's not sleeping at all. It was a really rough night for both of us. The next morning, Camila had her first appointment with her pediatrician. Her pediatrician had already talked to the neonatologist and just got a rundown on Camila's entire situation. So before her pediatrician even had met her, she already knew Camila's situation. So it was kind of nice, just so I didn't have to totally tell her the entire story. So we saw her the next morning at 9. I hadn't slept at all. Ben hadn't slept at all. We both go, and I'm just like really worried because I'm like, well, she hardly slept all night. She maybe slept in my arms for a few hours, but if she wasn't in my arms, she was in the bassinet crying. I would hold her. She was crying in my arms, maybe slept a few hours, but was panting most of the night. I almost went to the emergency room. I didn't know if this was normal or not. They were also concerned about her weight. Camila, because of her heart condition, it is harder for her to gain weight and maintain it. So we just wanted to keep a close eye on her weight. So the pediatrician did get a hold of her cardiologist and let her know about Camila's rapid breathing. And she did say that Camila's respiratory rate was in like the 70s, and that was very, very high. And I told her that's how Camila was breathing all night, and it freaked me out. Once our pediatrician spoke to the cardiologist, Camila was put on a diuretic. So this diuretic was Lasix, and this Lasix was going to help Camila get rid of any excess fluid, and that would help her breathing. It didn't really make sense to me, but I trusted her cardiologist, and she started the Lasix that day. The breathing did slow down, and that was a huge, huge relief, because it was very scary to see a 5-day-old panting for hours and you don't know what to do, and it freaks you out, and you don't know, are they breathing okay? Is her heart okay? I mean, the entire time I'm just worrying, like, is something else going to happen? Is something else going to happen to her heart? Is her heart just going to stop? Is her heart beating too fast? Is she breathing too fast? Is something wrong with her lungs? I mean, I still had so many questions of what was wrong with her heart that I was just worried that things were just getting worse. And it was very hard to deal with. We had to go, I think it was like the first 3 to 4 days being home after that first night. We continued to go to the pediatrician. The pediatrician lives super close to us, so I was very happy. She lives really like less than a minute away. We walk there, so it was really easy to get to. We were going every day for 3 to 4 days to check on her weight and to make sure that her breathing was doing better, and that the diuretic was working, to make sure she was maintaining weight and eating well. Camila at this point was eating formula because I was still not producing enough breast milk. She was doing a combination of breast milk and formula, but really mainly formula, because I just wasn't producing enough breast milk at the time. Me and Ben kept track of like Camila's schedule and our schedule and how we felt. I think we went like 50 something hours of like hardly any sleep. It was definitely a rough few first days. And I think that's, normal for any parents when you have your new baby home, but there was an extra level of stress with Camila's heart condition and just being scared out of our minds. We did have an appointment scheduled for May 5th with her cardiologist, and May 5th could just not get here soon enough. I really just wanted answers to a lot of the questions I had. After going to her pediatrician appointments, things, calmed down. She was doing better. She was sleeping better. She was feeding every 3 hours. She was doing okay. She had a few tummy issues. She seemed a little uncomfortable, but she was taking Similac Sensitive just to try to help with those tummy issues. My mom had taken the time off, so she was trying to help us with anything that we needed help with, but really, I think both of our families were just trying to give us a time to just be parents and to just enjoy having Camila with us, because we didn't expect to have her. On May 2nd, because we were not seeing family and we were, quarantining, me and Ben and Camila were just at home. We weren't going anywhere. We were only seeing our families, but our families weren't seeing anybody. We had seen online a lot of like virtual birthday parties and virtual baby showers, and it had come to one of my cousin's attention. I was telling my mom, Camila, Alexis should maybe have a virtual baby shower. And at first I think I did, it was before I had Camila, I had shrugged off the idea just because I was getting so close to having Camila and I was having complications that we didn't do the virtual baby shower. But the idea was brought up again after Camila was already born and she was home. And my mom thought, why not? Like, we need to celebrate that Camila's home. And yes, things are a little different than what we expected, but let's celebrate that she's home right now. And mom literally, I think, had like a few days and whipped up a drive-by baby shower. I called it a parade because that's really what it looked like. It was really cute. I'll try to insert a few pictures. I know we have a few that we didn't take too many, but I'll insert what I can. But my mom, what she did is she rented a few pieces like for the lawn, and there were just like baby shower decorations. And she had a table full of like desserts and a table for presents, and then like 2 chairs for me and Ben and Camila to sit on, and cars would pass by pretty far away from us, like over 6 feet for sure, and they'd come and drop off their present at the table and grab a dessert. And my mom had like party favors that they could pick up, so they would pick up a few desserts, they would pick up some party favors, and they were able to see Camila from 6 feet apart. It was a little hard to see. She was bundled up, she was tiny, and I didn't want people to get too close to her, but it was the best we can do considering the situation. But I know that they appreciated it, and I did too, because it was still our way of having our baby shower. I had gotten a lot of gifts before Camila had arrived. People were sending them, giving them to my mom, dropping them off, but there was still a few people that hadn't had the chance to drop them off yet. So during the baby shower, that was a good time for them to do that, and that was really nice. So baby shower was a lot of fun. It was more than what I had expected, but it was really special. It was really nice to have. It's definitely something that is very pandemic 2020. I mean, we'll always remember Camila had a welcome home parade. Yeah, she'll always have her welcoming home parade, so that was very special. And so that was on May 3rd. Camila had her cardiologist appointment on May 5th. And that was gonna be the first time she was gonna see her doctor. And I was very nervous going into this appointment because we were gonna get answers, but I was scared of what these answers were going to be. I was scared to know how many surgeries were gonna be. I was scared to know when this PA banding was going to be. We already know Camila's gonna have more than one surgery. I didn't know how many times Camila's chest is gonna be broken into, and that's very hard to think of as a new mom. I remember talking to my mom the day before her appointment with her doctor, with her cardiologist, and I remember telling my mom, I am so nervous for them to tell me Camila's gonna have her surgery, her PA band surgery, in a week. I would just be so scared. It would make me very nervous. May 5th, that morning, Ben can't come to the appointment because only one parent is allowed to come to the appointments because of everything going on with COVID. So it was a bummer because I know he wants to know this information too. He wants to have his questions answered too. I always go to my appointment with a notepad of all my questions to make sure I don't forget any of them, but it's still not the same as like being there. I mean, I could ask the questions, but it's different for me telling Ben than the doctor telling Ben what the answers are. We get there and he tells me he had seen Camila a few times in the NICU and that she was looking really, really, really good, and he was very pleased with how she was doing. And Camila had already been on the Lasix for about 5-6 days, and so her respiratory rate was doing a lot better. She wasn't panting anymore. Her breathing sounded great, but Camila had developed a very strong murmur that wasn't there before. Right before that appointment, Camila did have a chest x-ray that they wanted us to get done, so we went like that same day and so he had reviewed it. So he got the chest x-ray done and he heard a murmur that wasn't there before. Once we started talking, he did tell me more of what Camila's heart looks like and what it is, and what is going on with it. So Camila, same diagnosis. She still has a double outlet right ventricle with transposition of the great arteries, but Camila's ventricles, instead of being side to side, instead of being horizontal, they are vertical. So Camila has, on top of her two diagnoses, also has what they call upstairs downstairs ventricles, or inferior superior ventricles. She has three defects going on with her heart, and he drew different pictures for me to kind of give me an idea of what her heart looks like and how it's not going to be as easy to fix as they had anticipated or as what they had hoped, really. He told me that by the looks of it right now, they don't know if corrective surgery is really something that they can do for Camila. It could go a few different ways. So the first way they told me, what they want to do first is they want to give Camila more time to grow and her heart to grow. Right now her heart is very tiny, and we want to just give her time to grow before doing any type of potential corrective surgery on her heart. So right now we're going to do a pulmonary artery banding so that too much fluid does not get into her lungs, causing her rapid breathing. And we just want to give her 4 to 6 months to grow before we do any kind of surgery. That time will allow us to really look at Camila and do further testing and really see what kind of surgery can we do on Camila. After the PA banding, Camila would eventually get a CT and cardiocentesis done. During the CT, her heart would be slowed down enough where the CT would take hundreds of pictures, and they would make a 3D model out of the CT and cardiocentesis. They would make a 3D model of Camila's heart, and with that 3D model, they would figure out if corrective surgery for Camila is possible. The doctor really wants to figure out if Camila is going to be able to have two ventricles. They want to know if Camila's VSD is able to be corrected. There is other routes they can go if Camila's VSD is not able to be corrected and her transposed arteries aren't able to get corrected as well. It's not what any mom wants to hear, but so if the double ventricle, if having two ventricles is not in Camila, if that is not a possibility, what would happen is they would move forward with Camila as a single ventricle heart. So Camila would have a series of surgeries. So she would have two operations. One would be at about 4 to 6 months of age, and that would be called the Glenn operation. And it's a very hard to explain operation, so I'm gonna insert a picture and a brief, quick explanation of what it is now, of what it looks like. I know it could be kind of complicated, so I think the best way to explain it would be with a picture. And after the Glenn operation, she would have a few more years, maybe 2 to 3, just depending on how Camila's doing. She would then revisit the option of corrective surgery. The Glenn operation could give us more time to really figure out if corrective surgery is possible for Camila. Her doctor did tell us doing the Glenn operation on Camila is something that could be reversed. So we could reverse the Glenn operation on Camila and then do corrective surgery, or we could do the Glenn operation on Camila and correct her surgery and correct her heart. So she would have kind of like a ventricle and a half, is the way he explained it to me. Or Camila would just, at about 2 to 3 years old, she would get a third operation, which would be a Fontan surgery, or a Fontan operation. At that point, that would kind of seal the deal on Camila having more of a single ventricle heart. So hearing a doctor tell you they don't really know what route they're gonna go, they don't know if it's possible for Camila to have corrective surgery, is very hard to hear. If Camila is unable to have corrective surgery and have two ventricles, and need to go the Glen and then Fontaine route. Camila is going to be just more limited in life, and that's just very hard for me to like have to put her through. I never want to feel like she has to like be in a bubble and just limit her in any way. Camila would have to live just a more limited life at that point. She would need to be very careful for the rest of her life, not even just being a kid. She would have to be, have very limited exercise. She would always be at high risk for more heart complications throughout her entire life. Camila, as a heart baby, is already at a higher risk for, slower brain development. She's at a higher risk for having a harder time maintaining weight, gaining weight, growth development. All that is already harder for her, and just for like heart babies in general. If we would have to go, the single ventricle route, just knowing that there would be things that she couldn't do would be very hard for me to like not let her do those things. I mean, we didn't go into too much detail. I didn't ask too much of what that meant, but I mean, if Camila wants to be like a marathon runner, she wouldn't be able to do that. Ben grew up skiing. Does that mean Camila can't do that? Can she not ski with her dad? I don't know. What are going to be Camila's limits if she only has one ventricle? How far can we push her heart? I don't want to push her heart too much either. There would also be a lot of risks for other heart complications throughout Camila's life. He did tell me there would be things that Camila would have to watch out for the rest of her life. Camila would have to watch out for heart arrhythmias. Camila could need a pacemaker later on in life. Camila could start going into heart failure. Just there'd always be things that we'd have to worry about. Camila's gonna have to see a cardiologist for the rest of her life, and I know that. But having to go, the single ventricle route, I feel like we're always gonna have to be looking for more problems. We're always gonna have to be worrying, we're always gonna have to be looking for the next thing wrong. I'm always gonna be worrying, is her heart gonna start to fail soon? Is Camila gonna start developing an arrhythmia? Is Camila's heart beating too fast? What's gonna happen next? What's gonna happen in next year? What else is Camila gonna have to go through? It just gets really scary. It's really scary to hear your doctor telling you that they have really high doubts of Camila being able to have 2 ventricles. It's really hard having to hear your doctor telling you that he has high doubts that Camila will have corrective surgery. I want Camila to lead as much of a normal life as she can, and that's really hard for me to know. I don't know how normal her life will look like. So after, the doctor spoke to us about what different options Camila had, he did, we did say we're not sure where we're going, but we have, a few different routes we can go with this. We still don't know where we're going with it, but that's what the 3D model is going to help us with. The first thing is first, she needed to get her PA band surgery done. Because of her chest x-ray and the murmur she had developed and just how quickly she seemed to be getting fluid in her lungs, her doctor didn't want to wait very long before she got that PA band surgery done. It was very hard for me to hear that her doctor kept saying, oh, it's simple, it's a simple surgery, it's a simple surgery. I don't care who you are, no surgery where you cut open a baby is simple. I mean, you're cutting open her chest. You're cutting her chest open and breaking her chest bone open, and she's having heart surgery. She's having open heart surgery at, you know, weeks old. That's not simple to me. And I understand it might not be super complex and they're doing a whole lot, but it's still very hard. And he told me that he wants Camila to have surgery next week. And I kind of just panicked inside a little bit. I knew it was coming. I knew she was gonna have to have surgery. I was really scared. I mean, I had just heard Camila might in the future only have one ventricle. She might have a very limited life. She might have heart problems for the rest of her life. And now you're telling me, and your baby's having surgery next week. It's a lot to take in at once for anybody. I just gave birth to her less than 2 weeks ago. It's a lot. Like, it's a lot at once. It's hard to hear. And I didn't have any, I mean, it was just me and Camila. I didn't have Ben there with me. I didn't have my mom. It was a lot, you know, all at once. He said I'd get a call in the next day or two and the operation would get scheduled. And I think I got home, and later that day I got a phone call. Camila was gonna have surgery a week from the day she had her appointment with her cardiologist. So she had her appointment with cardiologist on May 5th, and on May 12th, being 18 days old, Camila had her first heart surgery. Before her surgery, there was some pre-op testing done, and she had to get a COVID test, and there was some pre-surgery stuff that had to happen. And that's what my next video will be about. Getting ready for surgery and what surgery looked like and what that felt like for me, and going to recovery too. So please like and subscribe, and I'll see you guys next week. Bye.